The first session I always have with people is usually a bit of a get to know you session, both from myself getting to know the client, but also the client getting to know me. The most important thing I find in therapy, and the thing I place the most value on, is the therapeutic relationship. If you don't gel with someone, that's okay, and you're not going to gel with everyone you come into contact with. So I like to use the first session just as a little bit of a, let's just feel this out, see where we're at, and see what we're working with, and see if this is going to be a good fit, because it needs to be in my experience.
So in really simple words, the therapeutic alliance,
yes,
it's really important for people to work with you?
I find that it is probably the thing that I place the most importance on, is the therapeutic alliance. If people don't feel like they can trust me and they don't feel comfortable with me, then I'm not going to be able to help them through what they're looking for help with. And it's, I think, very important to work that out in the early stages of therapy, so that the client's getting the most out of the sessions and we can make the most progress. You know, if it doesn't fit, it doesn't fit. That's absolutely fine.
Makes sense. People tend to struggle with the first session mainly because they have been thinking about coming to a psychologist, and it's a big decision. What do you think, or what are the things that your clients tell you when they come to see you that actually was the thing that helped them to be brave and calm?
The thing that helped them to be brave and calm. I think booking the session first and foremost, you know, adds an element of accountability. I think people might go and get a mental health care plan, you know, a year ago and might not actually use it for a really long time. But once you book the session and once you've actually, you know, made that step of, you know, a lot of people say that once they've made the appointment, the weight comes off a little bit because I've taken that first step. I think as a psychologist, we all know it's all about that first step, and sometimes that's just picking up the phone or jumping online and pressing accept to the appointment. That's the bit that takes the pressure off.
And a lot of clients I have heard that tend to talk with a lot of people, some of them with families, mothers, partners, friends, GPs. What's your experience? Who is the people that your clients tend to talk before they come with?
Most of the time I think it's the GP. I think a lot of people hold a lot of stuff internally, and they sort of buffer the people around them because they don't want to be this burden on people. So often it's health professionals that they talk with initially, and that often takes the pressure off as well, because you're talking to someone who's there for that, who can be objective and can give you a point of view that you're not going to worry about or be concerned about.
And how will you talk with your doctor about mental health?
I think as society changes their views around mental health, that conversation is getting a little bit easier, but it's still quite daunting. And often you've just got to jump in, I think, and say, look, this is something that I want to talk about, and I just want to get some insight and get a step in the next direction. What do I do? I think there's something very powerful about just asking the question and not being afraid of the answer.